Yahoyalip. Mogatata, Kile, Temerilang, Kenmur, Imedimur. Kile Joey Goan, Akamem, Imtongva, Impuganako, Kajojo, Kajuji Chukumamanabi. Kile Royroad, Manadeo, Ruther Rain, Harwick Kajojo, Imolibro Kobato. First and foremost, we give thanks to God for our lives and our health. We acknowledge the land of Akamem Imtongava for which we occupy. We acknowledge our chair of chiefs, our custom and culture, our leaders, and everyone that has joined us today. Let us bow our heads in prayer. Temerilang, kumulugin chuni naman. Peri lo arpagchat melala ko raman. Nganar tibang chugujugin pergo arwit kachuju. Tibang rain right burden leto jatanan ko raman. Im rain dar ko bato, manay pagmelala ko ralat. Nganar tibang kajuwi kachuju. Ilo den chijik, tiparigumba kumolo. Amen. Back to you, host. Kumolo.
Alani, thank you. Thank you for those beautiful words. We are so grateful to you for being with us and to everyone joining us today for the launch of the Native Hawaiian and Pacific Islander Data Policy Platform. It's so nice to see so many faces. Good afternoon. My name is Ninez Ponce, and I am the director here at the UCLA Center for Health Policy Research, and a professor and endowed chair in the Department of Health Policy and Management at the UCLA Fielding School of Public Health. We are thrilled to be here today to unveil our Native Hawaiian and Pacific Islander Data Policy Lab's first of its kind NHPI Data Policy Platform. For those of you who are unfamiliar with the NHPI Data Policy Lab, we were formed and founded in 2020 during the early months of the COVID-19 pandemic. We began hearing directly from members of the NHPI community the devastating impact that COVID was having on them. As a small group of researchers started scraping the data, we found that Native Hawaiians and Pacific Islanders were experiencing among the highest case and death rates due to COVID in the few states that disaggregated NHPI data. At one point, NHPIs had the highest per capita death rate in 18 of the 20 states reporting NHPI deaths. The needs of Native Hawaiians and Pacific Islanders have historically been unmet because data are not collected and published in ways that target the NHPI community. With the support of so many of you here today, the NHPI COVID-19 Data Policy Lab was created to address these striking gaps within data and research for NHPIs. We're now more than 2.5 years later. The lab continues to work tirelessly to improve NHPI data quality and create data systems, processes that provide meaningful opportunities for community involvement. I am so honored to be a lab member, and I'm so proud of our members for giving their hearts and souls to the work being presented today. And I'm also so grateful to all of the Native Hawaiian and Pacific Islander leaders and community organizations and organizers who contributed feedback and time to this project. We are here today because of you, and we are so thankful and humbled by your support. I'd also like to thank the Robert Wood Johnson Foundation for providing the funding and support that helped make this work possible. Now I have the pleasure to introduce our next speaker, Crystal Ka'ai, who is the Executive Director of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders. Her bio is displayed here, but I'd like to underscore that in this role, she is responsible for directing the efforts of the White House Initiative and Presidential Advisory Commission on AA NHPIs, and advising the Biden administration on the implementation and coordination of federal programs as they relate to AA and NHPIs across executive departments and agencies. Crystal previously worked on Capitol Hill for a decade, including serving as the executive director of the Congressional Asian Pacific American Caucus for 8 years. She has also held positions with the U.S. Senate Committee on Indian Affairs, the State of Hawaii, Office of Hawaiian Affairs, and the National Japanese American Memorial Foundation. Crystal was born and raised in Hawaii and is the first Native Hawaiian to ever lead the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders. We're so lucky to have her as a leader in Washington, D.C. Please join me in welcoming Crystal Ka'ai.
Thank you so much, Dr. Ponce, and aloha kako, everyone. As the Executive Director of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, or what we call WIONP for short, I am honored to be here for the launch of UCLA's Native Hawaiian and Pacific Islander Data Policy Platform. And I really want to thank Dr. Ponce as well as Alisi Tulua for inviting me to join you all today. When President Biden signed Executive Order 14031 last May to create the White House Initiative and the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders, he explicitly underscored the importance of data disaggregation for our diverse AA and NHPI communities. In fact, one of the key charges of both the White House Initiative and our commission is to expand the collection and use of disaggregated data and to facilitate improved research on policy and program outcomes for AA and NHPI communities. In this executive order, the president also tasked our initiative with working in coordination with the White House Equitable Data Working Group that the president established on day one of his administration as part of a whole of government approach to advancing racial equity. This commitment to institutionalizing equity across the federal government is deeply embedded in the work of our White House Initiative and is more important now than ever as our communities continue to recover from the devastation of the COVID-19 pandemic, which exacerbated so many longstanding disparities impacting our diverse communities. And as Dr. Ponce mentioned, we saw that, especially in the Native Hawaiian and Pacific Islander community, there were so many health and economic impacts that were really devastating to our populations. And yet, because not all states and localities disaggregate data for Native Hawaiians and Pacific Islanders, so much of that data and so much of the disproportionate impact was not readily apparent, especially at the national level to federal policymakers and to those in the administration. And that was a big problem. So I really want to commend UCLA in particular for the work that has come out of the NHPI Data Lab, because that research, that information has been so critical to informing policymakers, lawmakers, those in the administration of the specific needs and concerns of our NHPI populations and how we can better address them. We know that unfortunately, many states and localities still do not collect disaggregated NHPI data. And so again, I just really want to highlight the importance and the significance of the launch of this particular report in providing us with the tools that we need to ensure that we are understanding the disparities and better able to address so many of the longstanding challenges that our Native Hawaiian and Pacific Islander populations face. Thankfully, we have a president who knows that in order to fully address the multitude of challenges facing our diverse communities all across the country and to break down barriers to federal resources and programs, we need to have disaggregated data to pinpoint the challenges that specific communities are facing and also to develop targeted interventions and policies to assist our most vulnerable communities. And that is exactly what we are doing through the White House Initiative, where we have not only prioritized working closely with the White House Equitable Data Working Group and other White House components that oversee the administration's data equity work, but also working through our federal interagency working group with partners like the Census Bureau and other key federal agencies to really prioritize data disaggregation throughout the entirety of the federal government. We also have our President's Advisory Commission that I mentioned earlier, and Dr. Ninez Ponce is actually a member of this, our data disaggregation subcommittee, where she has lent her expertise and just tremendous wealth of knowledge to share how we can better, through the federal government, better prioritize data disaggregation and data equity for our diverse AA and NHPI communities. And earlier this summer, our initiative hosted the first ever White House AA and NHPI Data Summit at the White House itself, where we featured both government leaders and community leaders, including representatives from EPIC, Empowering Pacific Island Communities, to discuss the important work that we must do together to ensure that we are prioritizing the collection, analysis, and reporting of AA and NHPI data. And earlier this summer, the Office of Management and Budget announced that it will begin reviewing and revising its Statistical Policy Directive number 15 standards for maintaining, collecting, and presenting federal data on race and ethnicity. So there's a lot of really exciting work happening in the data equity space at the federal level and at all levels of our government. But really, I am so grateful. Again, I can't underscore how critical this report, how historic it is to have this information, this data specifically on the Native Hawaiian and Pacific Islander population. So I also want to extend my gratitude, not just to UCLA, but also, as Dr. Ponce mentioned, to all of the community leaders who helped to review this report, who provided their input to make this possible. Because of you, we will now have the tools that we need to really understand how we can better serve and address so many inequities impacting our NHPI population. So thank you again, mahalo nui loa. Really appreciate the opportunity to join you today.
Crystal, thank you so much for joining us, and thank you for being so present and for leading us, leading the initiative. I've been in those meetings, and you're just so critical in making our voice heard. So thank you very much, and thank you for joining us. I'm going to hand this over to Alisi Tulua, who is the project director of the lab. Just to our IT folks, I see that we may have gone over capacity, so I hope we can address that, as some folks are trying to get in, but I hope we can expand the capacity so they can join us in hearing this community meeting today. Alisi.
Thank you. Yes, my phone is going off. Apparently talking about data nowadays is pretty popular, so folks were trying to join us. Thank you so much for what has transpired so far. I have the honor of introducing a couple of community leaders that were part of the development of the data policy platform. First, who will share their experience in community and their experience in working with data. First is Josie Howard, with ancestral and childhood rooted in Onaun, which is a small island in the Chuuk State, geographically located between Chuuk Lagoon and Yap Outer Island. Josie Howard possesses a deep cultural understanding of the people of Micronesia that is woven into her success today, paving a path for the thriving Micronesian community in Hawaii. For her island education, to her bachelor's degree in anthropology and minor in biology with a certification in Pacific Island Studies from the University of Hawaii at Hilo. She later got her master's degree in social work and certificate in Pacific Island Studies from the University of Hawaii at Manoa. Josie continues to humbly and strongly uphold her values and respect for her culture and the culture of others, advocating for the overall health and well-being of people. Josie Howard is the founder and CEO of We Are Oceania, empowering the Micronesian community in Hawaii to navigate success while honoring the integrity of their diverse heritage. Before we have Josie speak, she would like to share a video, and so I will be queuing that up now. Give me 1 second.
The mission of We Are Oceania is to empower Micronesians to navigate success while honoring the integrity of our diverse heritage.
There's many services that WELL provides. WELL started off as that one-stop resource center basically to connect and bridge the Micronesians here in Hawaii to possible services they might need, ranging from healthcare services to social support services.
WOW gained its trust within the community, mainly because people within the community can relate to us, especially because we are from the community.
During the pandemic, we provided a lot of services. We provided a helpline that could answer questions from our community. We hired all the different languages in Micronesia to be able to answer questions that our community are calling about.
WOW hosted multiple vaccine clinics at our location.
It brought together our community in ways that we wouldn't think possible. In times like this, we really need to come together and just let go of our differences and just be there for each other.
When HIA approached us, with this possibility of doing analysis of our data, it was such a great opportunity, especially because we want to see how impactful we are with the programs that we have here at WOW. So my initial reaction to the outcome of our study, I wasn't surprised about the trust, and the satisfaction with the service, because I knew that our people were going to feel good. So through the data, we learned that within just the 6 months that we provided our vaccine clinics, we actually contributed 6% of the total number of Pacific Islanders who got the vaccines. And that made us very happy and proud. I really believe that the reason why Pacific Islanders trust our service or trust WOW, it's because WOW is staffed by members of their own community, people that they have relationship with. Our culture is all about relationship, and seeing a familiar face. On top of that, when they come to take the vaccine, they come to their own community, and that people were there and they feel safe. They feel like this people can take the place of my family in taking care of me, and that I trust that they will do the best.
Welcome, Josie.
Thank you so much, Alicia. I want to take this opportunity to thank the NHPI Data Policy Lab. And I just wanted to add to the video that in our culture, like in my language, there is the word alea, inet, pikiram. These are words for ways on how we collect data. Somehow data becomes very academic and very scientific and foreign to our community. So it's like a disconnect. So so when we bring this work to our community, it's really important that we are speaking the language that our community also understand when we are collecting data and that they can connect with. So all along, we Pacific Islanders have had collected data and have always depend on data in order to be able to take care of our community. And like Crystal mentioned, during the COVID, it really brought us the opportunity to work not on the state level, but also on the national level to fight for disaggregated data. WOW really depended on this. The way we staff our organization really depends on data. How many people come to us, who is coming to us, and what language they speak. When we talk about equity, and in our small communities, it's all about equity, that everyone, get the fair share or are taken care of, are not left behind. It's really important that we look at who is there. And I also want to add that with this study that we did with HIA, it allows us to understand that even though our mission is to empower Micronesians, we have helped almost everybody in the state of Hawaii, not just Micronesians. We have helped Native Hawaiians, Samoans, Tongans, Asians, Japanese, Koreans, Chinese. And that was a really eye-opening for us to see that our impact is not just for our Micronesian community, but for the whole community. So disaggregated data is really important to tell us the whole story. When we don't have disaggregated data, the story is not whole. And in closing, I want to acknowledge and thank the people that we serve. We are very privileged that they do trust us and allow us to serve them. And thank you.
Thank you so much, Josie. I know that we look to you as a leader in our Micronesian community, but also as a leader for our community overall. So thank you so much for spending time with us today and sharing your wisdom. Our next speaker is Ilona Ryan. Ilona's current position within C40's City Diplomacy Team supports the overall mission of enhancing cities as global climate leaders and aiming at influencing policies, markets, and stakeholders towards undertaking ambitious climate action with the ultimate goal of supporting cities to deliver on their fair share of the Paris Agreement while also promoting a green and just recovery from COVID-19. Prior to joining C40, Ilona worked for over 8 years in foreign diplomacy missions, most recently as a research officer at the Permanent Mission of Fiji to the United Nations. As a part of the Fiji delegation to the United Nations, she was tasked with assisting the ambassador and diplomatic staff on issues such as peacekeeping and humanitarian affairs, human rights, and sustainable development. She also assisted in the coordination of official visits of the President, Prime Minister, and Minister of Foreign Affairs of Fiji during the annual UN General Assembly. Her experience has left her with a thorough knowledge of the work being done by the United Nations, its many organs, as well as different non- and intergovernmental organizations. In addition to her professional experience, Ilona has a Bachelor of Arts in Political Science and Government from Hunter College and a Master of Science in Global Affairs with a concentration in International Development and Humanitarian Assistance from New York University. Thank you so much, Ilona, for being with us.
Thank you, Alice, and I hope you can all hear me well. So good afternoon from New York, everyone. And even though I worked for Fiji for many years, I'm Papua New Guinean, but people always used to just walk into the office and be like, Bula. So also Bula and good afternoon from New York. I just really want to go through a few slides of what I work on at C40 and just kind of show how I think my job and my activism around climate change really kind of influence each other. So I'll run through a few slides and I promise it's nothing too boring. So if we can go to the first slide. So what exactly is C40? It's a network of 97 actually of the world's largest cities in terms of GDP and population, and working to confront the climate crisis. Next slide. And so we work with the mayors of these cities who are committed to using an inclusive and science-based approach to a truly collaborative approach to help the world limit global heating to 1.5 and really building healthy and equitable and resilient communities. So we're in 97 cities, next slide, which represent, 700 million people worldwide. Unfortunately, none of our smaller Pacific Island countries. We're just too small. But these are the biggest emitters. But cities are also, why do cities matter? Next slide. And this is because even though they only occupy about 2% of the world's landmass, cities account for around 75% of consuming around 75% of the world's energy. We also create over 70% of the energy-related greenhouse gas emissions. But we also generate 80% of the world's GDP. And what we try to do is, in terms of cities contributing to climate change and where the solutions lie, cities are also diverse and innovative. They're actually more nimble than national governments. And they're also the hubs of financial, economic, and political power. And so we work with our mayors to advocate for a green and just recovery from COVID, and really leading the fight against the climate crisis. So key stats, again, there's actually 97 cities now and a quarter of the global GDP. And we're really pushing to raise climate ambition, build equitable and thriving communities, building a global movement, scaling up climate action, and sharing best practices, and facilitating access to finance. And really what we do on my team is taking all our experiences of our cities, where they're most vulnerable, who is the most vulnerable in these cities, where they're leading, and actually implementing action, positive action, and taking this to global forums like the UN climate change, like the COP27 meetings, and the UN platform, global platforms, and saying this is what cities are doing, and that's working, that this is where they're vulnerable. And this is why you need to include cities. Climate change is cross-cutting and it affects everyone. So we need everyone at the table. And I think for our work to be really effective, it has to be inclusive, and we have to know the breakdown of our cities, their needs, and who is the most vulnerable. Otherwise, we risk perpetuating injustices and not working with the most vulnerable, and finding the appropriate solutions. So, I mean, how does this kind of affect my own outside work, with the Pacific Island community and climate justice? I think, as I said, it's cross-cutting, and it impacts human security, food security, water security. It's not just on top of being in this whole environmental issue. And I think for you guys out there, for those that are in the West, I guess this past summer you dealt with some really bad heat waves that not only affected your grid system and your electricity, but that was also a health impact. It was also an economic impact, where if you had people that were on the lower income spectrum, you have to kind of like choose between your paying your bills and cooling your homes, and things like putting food on the table or medication. So climate change, what we see is that impacts all levels of society, and it's cross-cutting. It impacts people's daily lives. I think what's also really important that we're seeing from my past 8-10 years working on climate change at the global level is, I think, really important for us to kind of realize is that we as a community come from one of the most vulnerable regions in the world in terms of climate change. So our roots lie in the Pacific, which is the front lines of climate change. And so we are striving to also, here in our new homelands, to not be, the most vulnerable. I think that's the goal, right? And so anytime you have, that's why data is really crucial in representing us. It's crucial so that the policy efforts are efficient and really target the areas that they're meant to, and so that they're effective and yield the results. I think we cannot achieve these without, representative and accurate data. And I think, again, as I mentioned before, when we fail to be inclusive and not have representative data, we risk perpetuating climate injustice. We risk prolonging vulnerability instead of really working toward empowerment and resiliency of our communities. So I hope that made sense and I wasn't just babbling on, but that's really the gist of my work and how it's kind of really influenced my advocacy for climate change and specifically climate change and how it impacts not only our homelands, but us here in the US as well. So thank you for hearing me out. Back to you, Alicia.
Thank you so much, Ilona. I know And then also I want to say thank you again to Josie. Josie and Ilona are two of over 135 community leaders who contributed to the development of the NHPI Data Policy Platform. Many of you that are here, although I feel like we would have had more people if our room had more capacity, but many of you that are here participated and contributed to our building of this data policy platform. So as you can see, we have two people that spoke to represent the variety of experience and knowledge from our community. So we hope that what we have developed here captured the wisdom and the knowledge and the experience that our community has in the many areas where that are priority in the work that we're doing. So hopefully those that are able to join us on YouTube are excited about this next part, where we are actually presenting you with our NHPI Data Policy Platform, which we titled No Health Equity Without Data Equity. This is a project that is funded by the Robert Wood Johnson Foundation under a grant that we titled, and I'll share it here because I think it gives some context to this project, creating the model for data-driven policymaking for Native Hawaiian and Pacific Islander populations in time of pandemic to help promote health equity. So although this project started in the middle of the pandemic as sort of a response to help bring data equity, ultimately the aim is that as a community, we're moving towards greater health equity. Next slide. Today, three of us that are a member of the lab, Carla Thomas, myself, and Calvin Chang, were slated to provide this presentation for you. Carla sends her apologies. She had an emergency this morning and won't be able to join us. Carla so I will introduce her anyway, also to acknowledge her work and her contribution to this project. Carla is currently the Deputy Director at Empowering Pacific Islander Communities. However, she is one of the co-founders of the NHPI Data Policy Lab, and she had just moved over to EPIC about 3 months ago. And so we will miss her in today's presentation, but I know that she is here with us in spirit. My name is Alisi Dulua, and I am the Project Director at the NHPI Data Policy Lab, and Calvin Chang would be following me. And what we will be presenting today, we hope will give you an understanding of what was captured in the data policy platform. Carla's piece I will cover, we'll be talking about the development process of the data policy platform. And then I will go on to share about the framing and the structure of the data policy platform itself. And then last, but definitely not least, Calvin will present on the platform content, which includes data policy recommendations and action steps. Next slide. Before I share, I really want to give such gratitude to the home, what we call home, the NHPI Data Policy Lab, which is housed at the UCLA Center for Health Policy Research. Although there are two of us that are presenting today, we represent the work of many others. So I will name everybody here. Of course, you met our fierce leader, Dr. Nines Ponce. We're so lucky to be working under her care and direction and guidance. And some other folks that have been very pivotal and are a key part of our lab is Dr. A.J. Scheitler, Dr. Brittany Maury, who is from UC Irvine, Corina Penaya, who's also a co-founder of the lab and is our community engagement and research director. She is currently a PhD student at UCLA and is in class, so she couldn't join us today. John Greer, Nicholas Pearson are Calvin's colleagues from University of Chicago and our volunteers at the lab. Vanan Tran is a medical student at UCLA and also volunteers her time to assist with our work. Jessica Lee is an undergrad at UCLA, also volunteering her time with the lab. One of our evaluators, Dr. Jacqueline Tran, Tiffany Lopes, who is the Director of Communications at UCLA, and last but not least, Jacob Rosales, who is part of our data analytics team at the center. So as you can see, much of the work that we do seems like it's done, there are a couple of us that are in front of you talking about it, but there's a whole team. And these are just the few that we name, but there's a whole center that supports our work and our growth as the NHPI Data Policy Lab. Next slide. Okay, so why did we do this and what were we trying to achieve with developing an NHPI data policy platform? I know most of you are probably familiar with a policy platform where priority issues, key issues are presented and recommendations are made about policies that impact those issues. We took it one step further, or maybe made it a little bit more specific in that we wanted to develop a data policy platform that is looking at data systems and the policies that build and contribute to data systems, providing recommendations that can help bring data equity for our population specifically. So these are our key objectives, is to develop data-driven, data-centered policy recommendations that are necessary to achieving data equity for our communities. We wanted to understand the issues that are most relevant for our communities, what the data is that currently is available, what data is needed but doesn't exist, whether it's easy or difficult to access the data that is available, and any other impediments to the work that folks are doing around these issues due to the lack of data. And then lastly, we wanted to create recommendations for policies that will address priority issues and the data needs in those issues for our community. So these are the objectives that we took on in developing this process. So having that in hand, we had to go through some administrative processes in order for us to do work that is respected and accountable to the community, and responsible. So we created our plan and submitted it for IRB approval at UCLA, which means that what we put in place in our plan has all the safeguards that protects the community, that protects the university, that protects everybody, and make sure that we're doing responsible work. In developing our plan, we decided that our structure of research or collecting information for our community was going to be done through key informant interviews and focus groups. And alongside that, we had to develop some tools like develop consent form, which we ended up delivering verbally, developing the guides that helped us with interviews and focus groups, and then, of course, what our outreach plan is. And I think this is a really important part that I want to share here. It's usually something that people ask about, how did you do outreach? What was your outreach plan? So I want to share a little bit of that here. Also, I think will give a little bit of context to how we went about gathering the information. In our outreach plan, we made sure that we looked at our community, we looked at the regions where we have high populations. We wanted to make sure that we had regional representation, understanding that different regions might experience different, have different experiences. And we wanted to make sure that we capture that from our community. We wanted to make sure that we have ethnic representation across our Pacific Island communities. Also considering generational representation. Many times in this space and in this work, we often work with folks that are a little bit older. So we intentionally wanted to make sure we engage student groups. So we make sure that our young leaders' participation contributed to this. And also other considerations that were really important, looking at gender representation, ability, of course, areas of expertise. So we didn't want to just get everybody that's doing public health work. We wanted to get people like Ilona that's doing climate change work, so that we make sure that we capture as much of the diversity of our community as possible. Next slide. So once we had that plan in place, the implementation piece was what took the longest amount of time. And I think, as you probably understand this, having to recruit people, schedule, and have focus groups, and have key informant interviews, all of that takes time. So we broke up our implementation phase into 3 parts. Phase 1 was we really wanted to capture priority issues in our communities. And in these focus groups and interviews, our key question was, what are the priority issues in your community? We sent out invitations widely. I think we sent it to over 200 people, 200 Pacific Islanders across the country. And then those that responded, we scheduled for focus groups by region. So for example, we did a Northern California group, we did a Utah group, we did a Nevada, Arizona group. So we tried as much as possible to capture the Pacific Islander leaders in those regions. Overall, we ended up conducting 37 focus groups and 6 individual interviews in this first phase. We used Atlas TI for qualitative analysis. After phase 1, what we really looked at were identifying what the key priority issues are that our community raised. We then took that information into phase 2, and we asked everybody that participated to self-select themselves into the issues that they feel they were interested in or experts in. And so another round, scheduled focus groups, but this time it was by issue area. We identified, based on the initial analysis, 9 issue areas, which you will see a little bit later, and 3 special populations for considerations. And in these focus groups, our key question was, what are your data needs in this issue area? And so after conducting those focus groups, we ran analysis. I already explained this part. We again used Atlas TI to do qualitative analysis to see within each issue area what the key data needs are for our communities. And of course, we also asked not just about like what data they need, but what are the barriers in accessing data? Is there data that exists at all? So there were many different levels of information that we gathered in phase 2 that helped to inform the development of our policy recommendations. And then after we did the analysis, we then moved into phase 3, which was the policy recommendation development phase. We took all of the information from the first 2 phases and basically wrote up policy recommendations, figured out what's the best way to present it in a way that's helpful to the community, and at the same time helpful for decision makers, policymakers, folks that are researchers, people that touch our data. So that's the process that we went through for implementing our plan. So to share a little bit about those that participated, we had 138 Pacific Islanders across the country, including Alaska and Hawaii, that participated. And listed here are all the states that people came from that participated, and also the ethnic groups that were represented in all of our participants. As you can see, we tried as much as possible to have representation of the population of Pacific Islanders in the US. As you know, it is part of our culture to acknowledge everyone that has contributed to our work. And although this is one slide with many, many names, the take-home message here is that so many of you contributed to this. This is work that is from all of us and for all of us. And so I won't go through reading everyone's name, but these are all the people that were part of our focus groups that contributed to providing feedback to our policy recommendations. And I just want to thank everybody for giving their time and expertise to this project. So as I mentioned earlier, out of the analysis, we were able to identify 9 priority issue areas and 3 special population considerations. And the reason why we didn't just focus on priority issue areas was because when we were doing the focus groups and the analysis, we realized that although we captured these issues that cut across all of our populations, there were specific parts of our populations that had unique issues on their own. And so we felt that it was important that at the very least, we can attempt to provide a platform and a voice and representation for those specific populations. So the 9 priority issue areas that we identified include civic engagement, climate justice, criminal justice reform, community capacity, economic justice and housing, education, health, immigration, and women's rights. And the 3 specific populations that we gathered from the input from everyone is the Compactor Free Association population, our LGBTQIA+ population, and our Native Hawaiians in Hawaii population, acknowledging that there are unique challenges and issues that for our Native Hawaiians in Hawaii experience that does not exist for many of our other populations. So now that I've walked you through our data collection phase, and I want to at least give you an idea of the development, how we went about developing the recommendations. So this is just step by step. I'm summarizing it here. First, we did an analysis of our community discussions and identified the priority issues, which I already shared about. And then we identified out of the data issues, the data issues were identified by the community members to fall within multiple stages within the data lifecycle. So if you think about the data lifecycle, so you start at collecting data, and then there's analysis, and then after analysis, you determine like who's going to use that data, and even if the data is available to be used, access is at the very end of that, because you can have data present, but the access to the data is a totally different stage. And so based on the discussions and what we heard from the community, there were multiple issues, there were many issues across the entire life cycle of data. And so this helped us think about how we wanted to organize our recommendations. We decided to then organize the policy recommendation and develop them within the different stages of the data life cycle. Then we consolidated the data gaps and needs that fall under each of those stages. And then once we had the data gaps and needs under each of those phases, then we developed the solutions that aligned with those data gaps and needs. And those solutions were developed to align with our community values and some data equity guidelines that I'll share a little bit later. Then we submitted those recommendation drafts to the folks that were part of our focus groups, the community, and asked for feedback. And we went through 2 cycles of that with our community. And then we incorporated all the feedback into the final development of the data policy platform. All right. So this is, so then once we, so that was the process, right? Now we're going to move into how then did we frame the data policy platform? Because you can have all the information, but then how do you frame it in a way that appeals to your audience? And in discussing the development of this data policy platform, we decided that we have a couple of different audiences for this. Of course, we want this to be a tool that's useful to folks that are the data producers, people that touch data, policymakers, people that make decisions around maybe even data systems. But also our community is also another audience, because our community organizations and leaders are going to be the advocates that will take this information and make sure that they talk to their policymakers about it, that they make sure that some of the recommendations that we make may be considered for decision making. So we wanted to make sure that we didn't just write this for an audience of decision makers, people that are working with data, but also for our community. And so with that in mind, we took these three key things into framing of the data policy platform. We really wanted to highlight framing the data policy platform around this data disaggregation being a civil rights issue. So with the origins of OMB 15 rooted in the civil rights movement, the advocacy for data disaggregation is one of the ways that we ensure that data is available for our community in order to be in compliance, in order for us to measure whether the government is in compliance with civil rights laws. And so we wanted to make sure that that's something that we were taking into account in developing the data policy platform. Secondly, of course, is that it is framed around our cultural values of honoring work that has been done by those that came before us, of being holistic, of having a holistic lens and looking at the world in ways that are interconnected, and also making sure that we're thinking ahead at our future and how we are contributing to building the future of our community. So those cultural values were taken into consideration. And lastly, we drafted some guiding principles which were aligned with recommendations from the National Commission to Transform Public Health Data Systems. This is work that was done by Robert Wood Johnson Foundation and some of their partners. And we took inspiration from that to make sure that anybody that works with our data and our community thinks about these guidelines when they're doing that work. So the first guideline is recognition of historical discrimination and continuing impact on data systems, a commitment to responding to needs of communities with highest disparities, an establishment of community partnerships to guide priorities and approaches, ensuring accurate and sufficient representation of racial and ethnic groups and subgroups throughout all data systems processes, a respect for and responsiveness to cultural and linguistic diversity, and engage community in defining access to and ownership of data. All right, so we actually have a document that will be available digitally online that you'll get to download, and we'll send it out on email. But I want to give you an idea of how we structure it and why we structured it that way. When you take a look at our policy platform, you will see in the key areas of it where we provide our recommendations, it's broken up into pillars. And as I said earlier, these pillars are the stages of the data lifecycle. So first is collection, second is analysis, third is use, and fourth is access. And under each pillar, we explain what the challenge is with NHPI data with regards to each of the pillars. So for example, when you look at pillar number 1, which is data collection, we will describe what the NHPI community faces at this stage of data collection when it comes to data. So we wanted to make sure that front and center, somebody understands, like, so what's the issue here, right? So we present the challenge. And then followed by that are the actual recommendations, which were based on the needs, gaps, and challenges that we gathered from the community. Under each recommendation, we provide some context to why we're making the recommendation. And then some of those recommendations have even more specific sub-recommendations under them. Next. Another feature you will see on the data policy platform is something that came up when we were doing the analysis to to capture the different data policy recommendations. What we found was that across all of the 4 pillars, there was always a recommendation about making sure that community capacity is being developed. And secondly, that we utilize community-centered principles. And so what we decided to do, that instead of repeating it all throughout, that we really highlighted it and lifted it up to the top, because we felt like since it was mentioned everywhere, that it must be priority. So you will see in the document 2 bubbles that is focused on building community capacity under that pillar and utilizing community-centered principle under that pillar. Okay. So we have our 4 pillars with all the policy recommendations. And then in addition to that, we also wanted to make sure that we bring as much of our community's voices into the document as possible. So you will find 1 sheet that covers each of the priority issues and each of our special population considerations. And within each of those 1-sheeters, it was really hard to keep this to 1 sheet. The structure of each of these are as follows. We lead with some background on the issue as it relates to our NHPI community. We follow that with some of the available data and what stories they tell about that specific issue. And then lastly, we once again reiterate the data needs based on what the community said they needed for that specific issue area. So those 1-sheeters pack in a lot of information. We also throw in there a quote from the community. And also, because we couldn't cover every single data need in the write-up, we just give you a bullet point of some of the data needs specific to each of those issue areas. So that is an addition 12 pages of information, but we felt like we wanted to at least capture the voices of our community. Next slide. And then lastly, there's so much in here. Lastly is a couple of pages that give some specific action steps. And this is organized by, different different entities. And again, this is modeled after work that Robert Wood Johnson and their partners have done around transforming data systems. Where we made recommendations, for example, to some action steps that federal government can take, that state governments can take, that academic research institutions can take, et cetera, et cetera. So we wanted to give different opportunities for useful information to be presented to the community and to policymakers. So I think that's the last of the different features of the data policy platform. And I'm going to hand it off to Calvin, who will give you the actual content of our NHPI data policy platform.
Mahalo, Lisi, and aloha mai kaku. So I'll be presenting, as Lisi mentioned, an overview of the data policy platform's recommendations. Next slide, please. And just to provide a bit more context to these recommendations, I'd like to share a quote that combines several data issues that were actually raised by the community during the development of the policy platform. As you can see from the first sentence, the comparison that's being made is between Pacific Islanders and Europeans. And we often see in data sets that white populations are the bar by which other communities are measured by, and progress is measured often by that bar. Well, one of our hopes with this data policy platform is that we can look beyond that, and we can instead state that the goals that we try to reach will simply be to achieve the community's maximum potential. And if that is relative to where other communities are at, that's fine, but I think that this is a paradigm that we are more than excited about moving past. And we can also see that there are quite a few stereotypes that are mentioned within the remainder of the quote. And this is arguably a result of looking at just a slice in time, which is often what data represents, apart from a lot of the historical context and the cultural context by which our communities are familiar with, but many other researchers and those who collect data are not. Next slide, please. And as could be seen at the bottom right of the previous slide, the person who stated that quote was actually an American admiral in the late 1800s. So those stereotypes have been around for quite a while. And our hope is that the data that this data policy platform will be advocating for can help our community challenge those stereotypes and allow us to build our own narratives. And so as Elise mentioned, the data pillars that we will be using to organize the recommendations today fall under collection, analysis, use, and access, which is inspired mostly by the data lifecycle. And we do recognize that a lot of data lifecycle models will include additional components such as data maintenance and data governance. And those issues do appear within individual recommendations, as we'll see. But we also want to recognize and acknowledge that this document is something we hope to be considered a living document, something that will continue to adapt and change according to our community's needs over time. Next slide. So the way we address each pillar is by examining the challenges that were brought up by the community during each of those meetings that Elise mentioned. And when it came to data collection, by far and above, the most frequent complaint that many of our organizations and community leaders had was the fact that data simply didn't exist for our community, or if it did, it wasn't in sufficient numbers to be reported in and would fail to overcome suppression thresholds, or even when data was reported, it may not have been accurate. And lastly, there are privacy issues that can come when too much data is collected. Next slide, please. And so this just goes to highlight, even in our current day and age, several years into the pandemic, that Native Hawaiian and Pacific Islander data continues to lag behind that of other communities when being reported on state COVID-19 dashboards. As you can see, Native Hawaiians and Pacific Islanders simply have a large gap when it comes to COVID-19 cases, deaths, vaccinations, and hospitalizations being reported. Next slide. So the recommendations under Pillar 1 fall under partnering with community organizations to ensure that the data being collected is actually relevant to the community's needs. And in terms of improving response rates, community organizations are best positioned to be able to help data researchers and data organizations reach out and begin a dialogue with the community to understand what the community's needs are and to help the community understand why the data is being collected. And I won't be going through over every single recommendation, but I just wanted to point out a few highlights when it comes to data categories. There was a specific ask that we don't simply request that data organizations utilize the NHPI category, which is simply the floor under OMB 15, but that more granular categories that capture Native Hawaiian Pacific Islander subgroups be utilized. And that when it comes to defining those categories, that the multiracial definition be used. When it comes to the difference in population sizes, especially for Native Hawaiians, who have such a large share of multiracial people in their population, the difference between multiracial and single populations can actually end up doubling the population size and changing how rates are calculated. And when it comes to privacy, we live in a day and age when data breaches are becoming very frequent and very common, and there is a connection between how much data gets collected and stored by any single entity, which makes them vulnerable to data breaches, which could make our communities vulnerable in turn. And this is going to be an issue that we'll see come up in the pillar for data use. Next slide, please. So the next pillar involves data analysis. And as we saw from the initial quote, we know about the dangers when researchers and data companies attempt to analyze data without the community's participation, and they end up missing the historical and cultural context for our communities. And many fail to realize just how diverse the NHPI community is. Next slide, please. This is just an example from 2008 of an economist from New Zealand who published a report which, again, like the initial quote, simply mirrored a lot of stereotypes and failed to account for a lot of the reasons that these statistics exist in the first place due to colonization. And the dialogue that our communities can potentially have with data organizations in terms of interpreting these statistics could help dissuade, hopefully, some of these researchers from coming to these types of conclusions in which our community does not contribute, when in fact we very much do, especially as COVID-19 showed us in many of the essential industries and workforces around the country. And so the recommendations under the second pillar also involve applying community-centered principles, as Elise mentioned. Relationships really should be invested in with NHPI communities before a crisis hits. A crisis shouldn't be the first time that an agency or an organization reaches out to NHPIs. And as we saw, those relationships also matter in terms of determining the speed by which responses can be had to bring in resources to communities during emergencies and pandemics. But data analysis should also be prioritizing community needs and not just research agendas or private companies' agendas. And when it comes to algorithmic models that are spreading throughout various industries, we strongly recommend that these models that have been used for predictive policing or risk assessments that determine whether or not people are eligible for bail, that these be audited for bias, both in the data pipeline, in the analysis, and in the outcomes in which those models are used for. Next slide. And the third pillar is data use. Once the findings, once the data is analyzed and there are findings, how the data is used can be used to both benefit our communities and unfortunately harm our communities. Data is a tool and a resource. And what we found is that there are significant dangers that are worth paying attention to that we should be looking forward at, because if we as a community were to actually receive all of the data that we're asking for, how can we be sure that that data will not be turned against us, like it unfortunately has been towards other communities that do have access to their data? Next slide, please. Some of the more recent risks that can occur if our data is misused can be seen from the recent Dobbs v. Jackson Supreme Court ruling regarding the woman's right to choose. What that ruling did was open up for states the possibility that states could actually subpoena personal data that has been collected by various corporations and unfortunately be used to build cases against individuals. And the same thing could potentially be true for Alabama Senate Bill 184, which bans transgender treatments for minors. And the ability to track people, the ability to access people's databases and their health records, unfortunately, could potentially be at risk. And it's something that our community is aware of, and our recommendations try to address this preemptively. And lastly, the public charge rule. Many of our communities are subject, unfortunately, to the public charge rule, being immigrant communities. And that was temporarily just suspended during COVID-19 due to the emergency nature of the pandemic. But my understanding is that that is, again, making its way through the court system as well. And on the right, you can just see various examples of devices that continue to collect our community's data and information. And Google, in fact, just recently announced a $390 million settlement with states for improperly tracking users without their consent. Next slide, please. So our recommendations around data use is that the burden of taking action when data is improperly used should be shifted from individuals to the organizations that are profiting or benefiting from our data and that have the resources to actually deal with it on their end. And I think, as all of us knows, if you've ever had to click through a terms of use agreement, informed consent through such methods are certainly inadequate. And it shouldn't be left to our communities to have to look through hundreds of pages of legal documents to know what their individual rights are. Instead, what comes through our recommendations is that that burden really needs to be shifted onto the institutions. And there are numerous legal frameworks which are actually in use throughout the world today that can be looked to as potential models for governing how data is used properly. And lastly, we recommend that there be strong oversight with mitigation authority, which essentially refers to the ability for these models and the data uses to be turned off on a dime if it's found to be harming our communities, and for there to be a community presence on these oversight bodies. Next slide. And lastly, we have data access. What we realized from our discussions is that the data pipeline has a last mile problem. When it comes to actually producing data reports, it's not good enough for our communities to simply have access to an Excel spreadsheet with millions of rows. This needs to be provided to our community members in a digestible format that allows them to see what's most important to them. And what we saw during the pandemic were many dashboards that were extremely complex that threw out every possible data point out there. But that made it extremely hard for our communities to focus on the information and data that they needed. So what came up during our conversations was people were limited in terms of the utility of these dashboards and visualizations because they were too complex. Accessibility was an issue. Many of our elders may not have easy access to broadband and could use paper formats for a lot of these reports. But also the design choices, even as simple as font size, could make a huge difference in terms of allowing some of our elders to be able to access this data as well. Next slide, please. And so our recommendations are based around those concerns that the community raised with us. In terms of designing data products, there should be accessibility at the forefront of priorities. Making sure that the data is accessible in both physical and digital copies. What we heard is that despite the proliferation of a lot of data tools, one of the most widely used resources is a demographic profile that is almost 10 years old at this point, but is still widely used simply because it presents information in a way that is user-friendly for our community and prioritizes the issues that our community wants to see. And then when it comes to access, we also have to balance that with privacy, as we already saw, but there should be allowances and flexibility under emergency circumstances. For example, when COVID-19 hit, LA County did not want to provide us with data because we didn't meet their reporting thresholds. But that also meant that our community would remain invisible when we knew that cases were spreading fast. And so LA County was actually willing to be flexible and lower those thresholds temporarily for this specific issue to allow us to see how badly COVID-19 was hitting our community early on. And that enabled our community organizations to seek resources potentially earlier than they would have. And lastly, it's difficult to locate NHPI data. So much data is hidden across reports that include so many other measures and so many other communities. And the amount of time it takes to spend digging up our information is a burden in and of itself that many other communities may not have to deal with, but we do. And so what we advocate for is a centralized portal that will allow us to quickly and easily access data on our communities in a timely fashion. Next slide. So mahalo, thank you all for making it through this presentation. And I believe we have a few minutes for Q&A.
Calvin, actually, Kekoa has a question if you look in the chat.
I can read it. Thank you, Keiko, for sending this. So the question is, I'll just read the last part of it. Can these pillar recommendation results be leveraged by NHPI CBOs to argue for org funding and other NHPI community health funding initiatives?
Yes, that is one of our hopes, that this is a document that can be used in advocacy work moving forward. I think it strengthens advocacy arguments, being able to show that this is a document that doesn't just represent the needs of one particular person or organization within a small geographic area, but represents strength in numbers due to the process that we use in order to produce this. And so I believe policymakers are much more willing to listen to these types of recommendations when they know that many community members stand behind these recommendations with a united voice.
Thanks, Calvin. Yeah, there's another question here that I'll read out. But as Tiffany said, if you'd like to ask a question yourself, you can save us our voice and you can raise your hand and ask it and unmute and ask. But before I get to the question, I want to just acknowledge Dr. Tina Kao from Robert Wood Johnson Foundation. She's our program officer for this project and has been an amazing advocate in the work that we're doing in providing us insight and guidance along the way. So I just want to say thank you, Tina, for being here. I don't know if you're okay. I don't want to put you on the spot. We're known for doing that. But if you'd like to, oh, there you are.
Hi, Tina. Thank you so much. I'm just so honored to be able to work with you guys on this. It's such a much needed area that needs to be funded, and support for a population that just truly is invisible in many ways. So thank you all for your work, and thanks to everyone on this call for both participating on the webinar, but also for your support in informing the platform. It's just been such an honor to be a part of this.
Thank you so much, Tina. And we're so happy that you're here. Hi, Avery. Would you like to ask your question? I know you put it in the chat, but maybe you have another one.
No, Alicia, sorry. I didn't realize I could jump on to ask. My apologies. So I actually asked the question incorrectly. My question really was, between your phases for implementation, what was the time frame between each of the spaces? Because I'm sure once you get the data, you're asking the questions and you're trying to assess it for, all those things. I just want to know, like, what was the time frame between each?
Oh, we started this project last 2021. I think February was when we began to put together the application for IRB. And I think, I really should have looked at the timeline. I think the first phase took probably the most time because we did like general recruitment and invitations for participation. And then we, it was easy to get the areas where we had larger populations, but then we then had to take a pause and figure out like, who are we missing here? Who do we need to invite more? So that took a while to just keep going back and forth to make sure that we had representation across our communities. I feel like that took maybe 6 months. And then the second phase, which was another round of focus groups, it went a little bit faster because people self-selected into their groups and it was easier to organize those. So I think that might have taken maybe 3 to 4 months. And then our phase 3, we went digital. We were supposed to gather people again, but it's hard to get into people's schedules. Everybody's so busy. So we did 2 rounds of feedback over email. So we sent out the recommendations and people provided their feedback, sent it back, and we would work on it, send it back again with a fuller draft of the policy platform. So I feel like that took maybe like 4 months. This past 4 or 5 months was the actual like writing of everything. And there are many iterations of this. So I hope that helps.
Wonderful, thank you.
Any other questions? Hi, David.
Hi, I was just wondering, and I'm sorry if this might have already been covered, but I know that this is really a platform that community can utilize, but also like decision makers, like our county officials. And I was just, just scanning the participants. I was just wondering, does the Data Policy Lab, are you all willing to foster discussions if we are able to link you to our county officials? I think I can mention this, and I know that some of them were invited because they in turn forwarded the invite to me, but I don't know if there was a disconnect in them understanding that this is something that we wanted them to be a part of, but I don't see them here in the room. And so I was wondering if we can link them to you all to, I guess, just do like a soft launch with them directly.
We would love that opportunity. Naturally, it is the next part of this work is to get it out there and make sure that it's useful. Another part of this project is training, at data advocacy training with our community organizations, and probably part of that is making some of those meetings with our community partners. We don't want this to just be something that sits on in your hard drive and just rusts there. We want this to be useful to your work, to our community. So the next part of this is data advocacy trainings that we hope will help build capacity for our community partners, but also where folks can utilize the lab members in having these conversations with your policymakers.
Alicia, if I may, we will also invite policymakers to those trainings. So it's, I think the best advocates or the best ways that advocacy can really be scaled up and amplified is when the data custodians, those that are collecting the data and making decisions, that they think about all the pillars that we talked about in a way that they don't have to be reminded, because is Ilona still in the room? Like Ilona, he mentioned to us that she's the only Pacific Islander in this global initiative, and it's really a lot of pressure, and it's like, and it's very tiring to be the only advocate in the room. So our hope is that this gets scaled in a way that we're also changing the way that data custodians, that policymakers think. Sorry, Alicia.
No, that's great. Thank you. Yes, Danny Boy.
Thank you, Alicia. Thank you, everybody, for your presentation. And also just a quick shout out to the NHPI Data Policy Lab. They were instrumental in informing how we did our research here in San Francisco with our little community-led needs assessment, and played a pivotal role in helping us prepare to get ready for that. And so just thinking about how we are in the phase of implementing our recommendations and even strategizing on how we can utilize those recommendations to carry them further beyond us and our capability, and thinking about the work that you all are doing. How can we think about your recommendations in relation to our recommendations to, I guess, sort of elevate both, and put yours into practice with ours. Just thinking from like thinking about this, the CBO level, like programming level, to like maybe the advocacy level. Sorry, I hope that makes sense to that question.
You want to answer that, Kelvin? Or Ninez? Or anybody here from the lab?
I think I'll let Calvin answer, but that's such a Carla question, right? If she was here, she could, totally address all the levels. I think this is why we need your voice and your help in thinking about how to, what's the most effective way at different levels, and also to make sure we thread those levels. I think our training it's making us think, Alicia and Calvin, that our trainings, I don't know if AJ's in the room, but our team is doing the curriculum, that the trainings, maybe there should be at least case studies where there's the role modeling of, if you're the advocate, if you're the bureaucrat, if you're at the local level, if you're at the state or federal level. At the state level, I saw in the room, I don't know if he's still here, but Peter O from Office of Health Equity from the state was also in the room. So I do also want to acknowledge that if there's a way that we can blast this out or figure out how to, because the Center for Health Policy Research does have a following of legislators, both at the local and at the state and federal level. CDC folks come so that we can just remind them. And I'm sorry, it may have been one, maybe they tried to get in, they were like after that first 100. So that could have been what had happened, but we'll make sure that the word gets out, and we'll also make sure that we address all the levels that you mentioned, Danny. So I hope I got to, your thinking and how we could do something better.
Thank you.
If I could just add to that, one thing that we also want to make sure to recognize is the Data Policy Lab is certainly not the first NHPI organization to do work around data advocacy. Everything that we do has been built off of what our elders have done, especially those who advocated for disaggregating agents from Pacific Islanders when OMB was revised back in 1997. And even farther than that, those who participated in the civil rights movement. And so what we have been hoping to do is to synthesize what lessons we can in terms of applying those lessons to today's climate. And I think that there are specific steps that our organizations can take at various levels to use data for programs, for evaluations, for research. And I think what we're also seeing is our communities have been underinvested in for so long and looked over by so many funders and agencies that I think one of the first steps, and also this was brought up during our meetings, is that we need to start really bringing to attention that underinvestment so that we can help bring in funds to build organizations' capacities that can pay for staff that will have the time during the day to build relationships with health agency staff, with legislators, with researchers, and that will create bridges. And that's what we as a community are good at, building relationships, but we need the resources to be able to do it. And so I think that's one of the initial first steps that could really open the floodgates towards being able to use data more broadly.
Thank you so much, Calvin. And I'm really sorry we are upon the time now, and I know Nancy Glass, you had a question, but maybe I can take it offline after this. But I just want to say thank you with so much gratitude to all of you for being here, to everyone that's not here but has contributed to the work that helped to develop the data policy platform. Just please extend our thank you to all of them also. We look forward to continuing this work with you. And with that, I'd like to ask one of my mentors, Miss Nani Wilson from Asian American Recovery Services in San Francisco, to bless our way out.
Thank you so much, Alicia. Thank you, Calvin. Thank you, everyone, for this beautiful afternoon of coming together. I think we need to take a deep breath. It's a lot that we absorb. So let's all together as a village, just take a deep breath in and exhale. Take another deep breath in and exhale. One more, breathe in and exhale. I hope you felt those tingling feelings inside your body and soul from all that beautiful information that has connected us to our ancestors as we continue to create pathways for our future generations. We are here. We are not going anywhere. We are going to continue to move these concrete rocks out of the way to lay ground so that we can continue on this journey and path together. We have to do it together. There's no other way. We can no longer be overlooked. We have to raise up our voices. Thank you so much for all of the work you are doing. Many of us don't always bridge data and storytelling, but it's important that we do, because we do have to bring policymakers here to know the need of our community. So thank each and every one of you for continuously being a light, thanking our ancestors, and for our young ones who will follow. Please have a blessed day. Thank you again to the lab, all the great work you are doing. We appreciate all of you. Our heart is good, and we will continue to move forward. Thank you for the mana you bring to this space.
Happy Wednesday, everybody.